arm, and he also had some respiratory difficulty. The other arm appears to be normal. When he came to our hospital, his vitals were tachycardia plus his low blood pressure. He is 80 by 60 is his blood pressure, and he is having some respiratory distress also. In the past, there is history of tuberculosis, and he has certain cardiac elements also, and there is some apparent edema of the lower limb also. So this type of patient who comes to us with swelling of the hand following IV fluid, we have to see whether he is able to close his hands or not. हाथ बंद करिए. You see, he is unable to close the hand. Then अंगूठा चलाइए, उंगली चलाइए. He is able to move the fingers, but he cannot close his hand completely. And if you see on inspection, there are black spots and some swellings all over the fingers, and there is blackening of the finger. And if you see the dorsum of the hand, it is swollen and it is going up to the this joint, and then also up to the mid part of the upper arm. He has some say tattoos over the hand also. This may be a past one. So this type of lesion, and the other hand appears to be okay. He is able to close his hands, and there are some tattoos also on the other hand, on the chest also. So this is a chronic problem for him. But this swelling which is there in the upper arm on the right side is an acute onset disease. Now, if you see, you have to examine, you have to see for local temperature. Their local temperature on this side is raised, and we will see for tenderness. You see, it's highly tender, and there is edema of the whole hand. Tenderness is not there on this side, neither on this side. Here also there is no tenderness. As you go down gradually, there is pitting edema. You can see there is pitting edema. So this pitting edema is present all over the hand, and it is starting from the fingers up to 2/3 of the upper arm on the right side. So and he is unable to close his hands, and patient is looking sick, and he is toxic. He's got some respiratory difficulty. So this type of pathology, initially you would say it is a cellulitis, because there is swelling, there is tenderness, there is pain, and there is blackening. But this cellulitis is not ordinary cellulitis. This is necrotizing fasciitis. Why necrotizing fasciitis? Because there is blackening and there is edema of the hand, and the pain is out of proportion to the swelling. So he is wincing with pain, severe pain. So this type of lesion is very, very serious, because it affects the fascia and the deeper structures, and it is a progressive disease. It can go up to the chest wall, and it can go to the neck also, and it can affect the upper part of the body, and he can have multi-organ failure, and this can result in death. So this is a serious issue. So the first thing which we do in these patients is to first start an IV fluid, which we have already started. First of all, what is a necrotizing fasciitis? It is an infection of the fascia, deep fascia, and it is a progressive disease, and mainly it is a bacterial infection, mainly caused by streptococcus. It can also be caused by Staph aureus, and it can be single bacterial infection or multiple bacterial infection. And sometimes fungal infection is also a cause of this type of lesion. But most of the time it is streptococcus and anaerobic bacteria are also involved. So we have to cover the whole spectrum. So the antibiotic should be such that it covers the bacteria, especially streptococcus, staphylococcus, and then also anaerobic bacteria. So that is the first thing which we have to do after stabilization of the patient. The second part of the treatment is debridement or decompression of the cellulitis which is there. And when we open it, we will find blackening in the tissues. So all the black tissue has to be completely excised. And this may not be a single procedure. It may be needed to be repeated again if the infection is progressive. And we will not close the wound. The wound has to be left open so that there is oxygen which is going inside. So that will help the patient for healing of the process. So now once we have stabilized the patient, we have to start IV antibiotics covering gram-negative, gram-positive and anaerobic spectrum. And once the patient is stable, he has to be shifted to the theatre, and a long incision has to be given which will cross this joint and this joint, both on the dorsum and on the front of the hand, so that the whole this area is decompressed, and then we will see what is the dead tissue. Whatever the dead tissue is there, we have to remove it. So after that, hopefully the progression of the disease will be stopped, and gradually over a period of 3 to 5 days, the cellulitis will subside and the antibiotics will be effective. So the spread of infection to the other organs. What happens in this case, if it is not treated at an early stage, the infection will involve the other organs. It can cause cardiac issues, it can cause renal issues, it can cause central nervous system involvement. So all multi-organ failure can occur in this case. So whatever is needed is urgent antibiotic therapy, oxygenation, resuscitation, pain control and debridement. So with this, hopefully this patient will recover. And oxygen should be supplemented at all times. So ideally, oxygen chamber if it is available, the patient should be kept in oxygen chamber. That will take care of the patient and will give much relief to this patient. So with this treatment, hopefully this patient will survive, and we will inform you later what is the progress of the case. Thank you.